All right, dads, which prenatal visits should you go to? This is Dude Expecting, where we're looking to give information to all partners, family members to support the pregnant person. Again, don't let the name fool you. This is for all partners. All right, common question we see is, what are the prenatal visits like? How many should someone go to? And how can they best prepare for these prenatal visits? Now, congratulations on the positive pregnancy test. What you're going to do after you're done celebrating is go ahead, contact your office, and establish with your doctor, if you haven't already. Your first prenatal visit is going to be around 8 to 10 weeks of the pregnancy, potentially sooner if someone has additional risk factors. And what are these visits like? Well, usually the first prenatal visit is the most in-depth visit, the longest visit you might have. It's very important for the partners to be there because we might have some questions regarding your own health history and information about your side of the family. And often what you'll probably have is an ultrasound at this visit. Usually after the first prenatal visit, we're generally seeing patients about every month or so until the third trimester, at which time usually every 2 to 3 weeks, because we're additionally looking for more potential risks of the pregnancy that often pop up later in the pregnancy. And then in the last month, we're usually seeing you about every week or so. In total, that makes about 13 visits in a normal pregnancy. And this doesn't include the potential visits for consultations or additional ultrasounds. So the big question is, guys, which visits do you go to? And it's an easy answer. You go to all of them. Unless you guys have communicated and maybe the benefit of you being somewhere else outweighs you being there at the prenatal visit, I would hopefully expect partners to be there at all visits. However, this isn't necessarily always true. I would say partners are usually there for the first visit, that 20-week ultrasound, and then intermittently throughout. And why do we say that we want the partners there a little more often? Well, because sometimes we give a lot of information, and actually hearing that information, digesting and remembering that information can be difficult for anyone. And so an extra set of ears can definitely be beneficial there, but also helping in potential decision making, especially as we're getting further along in the pregnancy and talking about delivery and what to expect going forward. And I would potentially expect there to be more frequent visits if the pregnancy is getting a little more high risk, because we might need to do additional monitoring for mom and baby. All right, partners, guys, what can we do to help prepare ourselves for these visits and make everything go a little more smoothly and safely? Well, we want to know, again, our own health history and our family history to help see if the pregnancy is at any additional risk. One way we could do that is actually get carrier screening for ourselves. Now, this is looking for potential genetic or abnormal genes that we carry. We might not have symptoms of those genes, but sometimes if 2 people have a gene, that can make some pretty drastic symptoms. For example, if someone carries the allele or the gene for cystic fibrosis, but they don't have 2 genes, they're not going to have symptoms. But if you get 2 people together that both have the gene, the baby could be at potentially risk for having something like cystic fibrosis, which can have some pretty significant impacts on someone's life. You're also going to want to have the discussion regarding if you guys want what's called prenatal genetic screening. This is looking for potential abnormal chromosomes with the pregnancy, and this isn't a test that all people need to do. There are some populations which might be a little higher risk of genetic issues. For example, if someone is a little bit older, they potentially have an increased risk of potential genetic syndromes, and so we often recommend in those populations getting these testing done, but in no means is it necessary. Often a question we get is, well, even if I found out my pregnancy had Down syndrome or potential other chromosome abnormalities, they might not want to do anything about it. But that's not always why we say we would recommend screening being done. We often recommend screening to be done because if we found a pregnancy with a genetic abnormality, we might want to watch it closer. and do additional ultrasounds or additional testing to make sure that both mom and baby are healthy. Again, you have a few options when it comes to genetic screening, so educating yourselves prior to the visit is always helpful. It's very important to distinguish between prenatal genetic screening and prenatal genetic testing, because prenatal genetic screening, what we just talked about, is non-invasive, meaning it's just a blood test or an ultrasound. Now, prenatal genetic testing, that is more invasive. That's generally what someone might confuse things with. That is the invasive test where they potentially use this long needle to poke their mom's belly to get the amniotic fluid cells to give you that for sure yes/no answer. Again, taking a step back, prenatal genetic screening gives you, is baby at higher risk or not? It's not the for sure yes or no. It's very accurate, but it's not the for sure yes or no. Prenatal genetic testing is that hopefully for sure yes or no answer. So if someone had abnormal screening, they might do the testing. Or if someone has a high risk, they really want that yes or no answer, they might do that testing. All right, I hope I answered some of your questions regarding the prenatal visits and going forward. We're gonna get more in depth regarding each of these issues going forward, so stick tuned with us. Give us a like and subscribe if you enjoyed the video. Have a great day, everyone.